We welcome you again to another episode on the pew and the pulpit. We are a church in the Bronx, New York. If you find yourself anywhere around here, we implore you to visit. With me today in the studio is the Dr. Somechukwu Onuoha, a medical practitioner and a member of this parish. This program is aimed at enlightening our people, so he has offered himself to discuss important health topics in this program to enable Christians and Anglicans watch over their life and health. Doctor, you are welcome to this program.
Thank you.
Today, I want us to discuss a very important topic. Sir, what do you understand by the word urinary incontinence?
Good day, viewers. Welcome again. We're continuing our educational series today on the genitourinary tract, which is the urinary area, the bladder, the kidney, the urethra, and all the whole system that helps us get urine out of the body. So today we're going to be discussing urinary incontinence and maybe any other topics bothering that. Urinary incontinence. Simply put, this is leakage of urine, involuntary leakage of urine. So if urine should come out of you when you do not intend to void or urinate, you haven't gone to the bathroom to urinate, you do not intend to urinate, and urine comes out, that is urinary incontinence.
Wow, wonderful. Today, the doctor has shown or has tried to explain to us what urinary incontinence is. What is urinary incontinence in a layman's understanding, please?
Yeah, so like I put it, involuntary leakage of urine, and this is a problem that has been there from time immemorial. Even before the advent of modern medicine and science, human beings, as long as we've existed, have had that due to multiple reasons. And believe it or not, there are some misconceptions about urinary incontinence because people who inadvertently leak urine are looked down on by others and oftentimes called different names in different areas. Some people feel they are possessed, all sorts of things, derogatory remarks, people are castigated against because they have this problem. But it is a medical problem, we know. Here in the United States, we spend about $26 billion treating problems relating to urinary incontinence.
Wow. What are the risk factors?
So urinary incontinence, risk factors mainly border on anything that makes the lower part of your abdomen weak, or anything that interferes with the neuronal mechanisms that send information from the higher centers. When I say the higher centers, it's the brain and the spinal cord, where you have the neural connections that go to the bladder that help us to urinate. So what are the risk factors? So one is increasing age. Unfortunately, like we say, many things in medicine are with increasing age. So that's why it's always good for you to enjoy your life. Every minute, don't allow it go by you, because as your age increases, so do these multiple medical conditions creep in. So with increasing age, in younger people is not common, but from above 65 years of age, the incidence is about 15 to 30%. And for people who are in residential accommodation, like people in nursing homes and so on, which will be mainly people above their 80 years and thereabout, the incidence is more, about 40 to 50%. So it's a very much something very common as we increase in age. Other things that are risk factors are dependence on activities of daily living. So, which also most times is related to increasing age, but then even for young people. If for any reason you have to depend on someone to get you to the bathroom, that means if you want to void, you need that assistance. When that assistance is not available, you might void before you get there, which is not your intention, and that will be urinary incontinence as well. Other things are disease conditions, so diabetes, neurological conditions. Any disease condition that affects, like I said, the neuronal connection between your brain, your spinal cord, and the urinary system. Any disease condition that affects this in any way, shape, or form will affect your genital urinary system and your ability to void effectively. So it brings us to areas that control urine void without taking so much time and going deep into the medical aspects of it. The brain and the spinal cord are the higher centers that control voiding. And then you have a set of nerves that are also around your bladder. So from the pontine area in the brain, signals are sent down to the spinal cord. Now, if we do not have the brain centers inhibit the lower centers. So they give signals to the lower centers to tell them not to void. And that is the reason why you don't void all the time, because your brain is there to give a signal to stop the lower centers. Do not open the bladder. It's not time to void. And when you want to void, the brain sends an information to them to void. So when there is a disconnect in some way, shape, or form, there are problems. You could void when you shouldn't. So in a layman's term, that's the best way to explain this. Disease conditions, like I mentioned, diabetes, which most times affects our nervous system, could lead to urinary incontinence. So if you're diabetic with increasing age, it is something you have to watch and discuss with your doctor. Do not be frightened if for any reason someday you're incontinent. It could be as a result of the disease. It could still be as a result of other things. Urinary tract infection. So any infection of the urinary tract. And when we say urinary tract, it starts all the way from the kidneys, which are the two large organs in your abdomen, to the ureters, which are two tubes that connect the two kidneys to your bladder, and your bladder, which is kind of the sac in the central portion of your lower abdomen, and the urethra, which is the tube that connects the bladder to the outside for you to void. Any infection of this is what we call urinary tract infection, and this could cause some irritation of this system, and this could make you void before you even get to the bathroom. Then finally, surgical procedures. So people who have some kinds of surgical procedures as a complication could have urinary incontinence. Most notorious is prostatectomy. So if your prostate is removed, remember we talked about the prostate the other day, that support which the urethra has is gone. And as a result, there could also be some irritation of that part of the urethra, which is the prostatic urethra. So that could make you void more frequently or become incontinent, which is void when you don't intend to void. Thank you.
Are there any types of classifications for this?
Yes. So there are various classifications, but always in this educational series, as we try to make it relatable to the general public, not to put so much medical jargons. There are many types of it, but the commonest types are about 3 of them. So the first one is urge incontinence. Remember, incontinence is involuntary. For the urine is involuntary voiding of urine. There is also bowel incontinence. So once you hear incontinence, incontinence means a kind of loss of control. So something goes out of you without you wanting it to go out of at that time. So if it's urine, it's urinary incontinence. If it is feces, which is stool, it could bowel incontinence. So having urinary incontinence at any point, the types, like I said, 3 major types. First one is urge incontinence. Urge incontinence, just as the way is said, is you want to void, but you cannot wait until you get to the bathroom. So you are unable to hold. So you want to void, you have to void immediately. In common parlance, in the urology clinic, urologists are doctors that look after the bladder and the genitourinary system. So they say those patients are the patients that come and they call them, I got to go, doc, I got to go, I got to go. So that means they feel like they want to void, they have to void now. They can't wait. If the bathroom is a few meters away, too bad. They got to void on their way. So most times those people, we tell them to wear diapers or some collective device that could help hold this urine. So that's urge incontinence. The other one is stress incontinence. Stress incontinence, also as the name applies, is there is some stress to the genitourinary system. The body cannot hold and it has to let the urine out. So things that happen, for example, somebody tells you that when they cough, urine comes out of them. Or when they sneeze, urine comes out of them. So either of these, whether coughing, sneezing, or when they are trying to lift an object and urine comes out. So these increase the pressure in the abdominal area. And when the pressure is increased, what happens is that they are not able to hold the sphincter, which is the closing part of the bladder or the urethra, and urine comes out. So that's the second one. The third one is a mixture of both. So you'll be surprised some people will come and they have both urge incontinence, that is, they want to void urine, they can't get to the bathroom. And the second part again, they say, well, doc, whenever I sit even in church and they were singing, I stand up suddenly, urine comes out. It's very embarrassing. So that means that person is having a combination of both. Urinary incontinence is more common in women. The ratio is 2:1, women to men. People have postulated many reasons for this, but one of the commonest reasons is because the urinary tube, which is the urethra, which connects the bladder to the outside of the body. The urethra for the woman is smaller in length. The length is about 4 to 5 centimeters for the woman. But for the males, it's longer, about 15 to 17 centimeters for the male. So you can see that the distance that the urine has to travel from the bladder to the outside is longer in the male compared to the female. That's one reason. The other reason also is that the female anatomy, the way the female body is built, is different from the male. The female body, the lower part of the abdomen, which is the pelvic area, has many structures there, including the uterus, which adds more weight and takes up more size there, as against in the male, where it is only the bladder.
You see, if you have a problem and the problem have no solution, that's double problem right there. So we want to know, Doc, are there treatments for these kinds of health problems that you've been discussing?
Yes, thank you very much, Tiara. So urinary incontinence. So first thing is to recognize the problem. And the other thing is for us to diagnose it before we treat it. So diagnosis usually as we go through in our medical practices, the first thing is usually the history. So ladies and gentlemen, when you go to the hospital and you tell the doctor, Doc, I read it on the internet, I have urinary incontinence, give me treatment. And the doctor starts asking you, all right, how many times do you void? Where do you void? Don't feel annoyed. The doctor is only trying to take history because that's the first part of our diagnosing any medical condition. So the history will always go around medical conditions that you have. Remember, I told you that the fact that you're having urinary incontinence could be because of diabetes. It could be because of the prostate. It could be because of many other problems which you do not know. And if we don't address it, the incontinence will continue. So please do not be offended if the doctor asks you some questions you feel that are extraneous. So we try to know what's the cause of the incontinence. Then we try to know the extent of the incontinence. To know, is it stress incontinence? Is it urge incontinence? Is it a combination of both that you have? Then, from this history, we do the examination. The doctor is going to examine you, your abdomen, to see is there any areas that are tender, that is painful, and so on and so forth. And then there are some tests that we do. We try to do a urine test because one of the commonest causes is urinary infection. So if it's a urinary infection, the doctor will just give you an antibiotic, and that could solve the problem. Then we do tests also to check your prostate if you're male. We check your genitourinary tract. We check the reproductive tract for the women to know also it could be an infection some other place, the uterus and so on, that is affecting your urinary system. So with this, we determine whether we're happy with what we have seen and we're able to make a diagnosis. If we're not able to make a diagnosis or somebody is having repeated urinary tract infections, then we can order some further tests. Some of them could be imaging like an ultrasound. For example, if we feel that there is a structure that is pressing on your urinary tract and making you to void so frequently and unconsciously, then From the ultrasound, we can do some other tests as needed, CT scan, MRI. Some people have come with urinary incontinence and they were found to have a cancer. So, ladies and gentlemen, when you have these problems, no matter what people around you say, talk to your doctor so that you can avert danger on time. Then, treatment options. So there are many treatment options. One of them, as usual, we move from the non-pharmacologic to surgical. So the non-pharmacologic treatments, again, is lifestyle. To know if you're having incontinence, what is causing the incontinence? If there's any activity that is leading to this incontinence that you can avoid, yes, we tell you to avoid, but obviously you're not going to avoid your normal daily activities that everyone does. Then if it is maybe the way you drink, then we can avoid that. If it's maybe you're drinking so much alcohol, that's another thing that could make you incontinent or make you urinate frequently, then of course, we can also discuss that. Then we go to pharmacologic treatments. So for the incontinence, if the incontinence is because of a medical problem, like I said, we treat it with antibiotics. If it's because of a structural problem, so for example, there is the muscles in your pelvic area, which is lower abdomen, are loose or lax, that is not contracting to close the system when you don't want to void, then we can recommend exercises. The commonest one is what we call the Kegel exercises, K-E-G-E-L. These are exercises that strengthen the pelvic floor. Most women after delivery, especially those who had vaginal delivery, will tell you that, Doc, urine is just coming out these days. It's just like an express road. So it's because after delivery, most muscles are lax. We teach you how to do these exercises to contract, to get the muscles stronger again. So that's the treatment option for if it's these causes. Then, of course, it could be because somebody is having spasm of the bladder wall. So the bladder is the collection tube where urine stays before we put the urine out. So some people, the muscle is just, they are just spasms, contracting, squeezing all the time. So urine is coming out all the time, even when you don't want it. So such people, we give them medications to quieten the bladder. So commonest medication is one called oxybutynin or ditropan. We give it, most people will give it just at bedtime, long-acting medication. Some people will need multiple doses. And then that's just one form of medication, and then there are other forms we could also give for people who have these spasms. So in terms of surgical treatment, for people whom incontinence is so recalcitrant, recurring, and there's no solution for medical treatment, they do pelvic muscle repair. So they can do sling surgeries to strengthen or tighten the muscles in the pelvic area and the sphincters.
Wow. Doc, what would be your general advice to the general public?
General advice to the general public, urinary incontinence is it's a condition that is prevalent in older population. As we get older, what happens is that the bladder mass is reduced, the volume is reduced, the amount of urine we can hold in the bladder is reduced, the coordination or the contraction of the bladder muscles is not as good as it would have been when we were younger. As a result of this, and when we get older, most times we are dependent on one activity of daily living or another. Because of this, there is an inherent deficiency in our genitourinary system as we grow older. So do not worry about what people say. It is something that comes with increasing age. What you need to do is activity management, speak to your health professional, and if it's an infectious problem, it could be treated. If it's something that needs any other forms of treatment, it could be
Thank you, Doctor. I want to thank you for tuning in today. With me, like I introduced, is Dr. Somechukwu Onoha. Doctor, you have done so great today. Thank you for coming.
Thank you very much.
We hope to see you next time. Please, if you're anywhere around the Bronx, don't forget to be with us. Thank you and God bless you. Bye-bye.